Okay, the next is going to be the pelvic girdle, or the pelvic joint, hip joint, and the lower limb. This is a pelvic bone, also known as the coxal bone, and it consists of three parts. This major part, it's like half, which is the part that's not covered right now, the whole thing here. This is called the ilium, and you see a bulky bone back here, which is called the ischium or the ischium, and this is called the pubis. So ilium, ischium, pubis. Three bones together are making the pelvic bone. So you can see here a foramen here that's called the obturator foramen, and this cavity right here, it looks like a cup-shaped or like a half of a sphere, hemispherical shape, and this is called acetabulum for the articulation with the head of the femur. Acetabulum. If you look here, this is called the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. These are the spines that you're going to see here, and this is called the iliac tuberosity, right here. Okay, so around the acetabulum here, in front of it, this bone right here is called the pubic bone, and this is called the ischial bone or the ischial bone. The bulky one toward the back, the bulky one is very bulky. Compared to this is called the ischial or the ischial bone, and this is the pubic bone. And this is the ischial tuberosity right here, the big pulp, and this is the ischial spine. This is the ischial ramus. Here's the pubic, and you have two rami, superior and inferior rami, and this is the pubic tubercle right here. So the two bones should go together, two halves. This is probably the right. This should be another one the left. And this surface right here is called the auricular or articular surface that articulate with the sternum. I'm sorry, the
sacrum.
The sacrum, I'm sorry. The sacrum, it should articulate like this. And right here, you should see the other one. So this is for articulation with this, with the sacrum. The next bone here, which is going to articulate, is the femur. And again, you have two heads. Here is two necks, I'm sorry. This is the head, this is the anatomical neck, and this is the surgical neck. So anatomical neck is the neck that's follow the head. And you see two tubercles here. This big one here, it's called trochanter here. It's not a tubercle, it's a trochanter, which is larger. So greater trochanter and lesser trochanter, and this is the intertrochanteric line. This is the shaft, and these are the condyles. This is the medial, and this is the lateral. How did I know this is the medial? Because the head is always medial. This is articulating with the body, so it's closer to the body. Same side is called the condyles, and these are the epicondyles. This surface here, right here in the back, the same as a tubercle, and this is called the popliteal surface, and this is called the patellar surface. So it should go like this. If you put it together, you're looking at the back, right, like this. So this is the popliteal fossa, or the popliteal surface, and if you go to the front, where the pubic bone is, you will see this is the patellar surface. So the patella should be here. You can put this like this. This is the femur again, and this is the tibia. And the fibula should go lateral, like this. So femur, tibia, fibula. The large, huge bone, bulky bone right here, this is called the tibia. And this is the tibial tuberosity right here. And these are the articular surface with the condyles, with the condyles of the femur, and this is the intercondylar eminence. This is an eminence that goes between the condyles right here. This is the tuberosity again. This is the shaft, and we don't need to know much about the femur, except it goes lateral, and it is lateral. And because it goes lateral, the tibia is medial, so this is the medial malleolus, and this is called the lateral malleolus. So tibia, fibula. And the next is going to be